We take the DHT molecule and we turn it cleverly into the free testosterone molecule, which gives our patients more energy. The oral works inside the body to stop what caused the hair loss, and then the topical will regrow the hair follicle.
Dr. Ray Nettles is redefining hair and hormone health with data-driven precision, transforming patients through custom biochemical insights. Get ready for a conversation about real results and lasting health.
Good morning, Doctor, and welcome back to Q&A with Dr. Ray.
Good morning, Tracy. How are you?
I'm doing great, thank you. Always choose great, right? If you can.
That's it. Today better than yesterday, tomorrow better than today. God orders the steps, we show up. That's the relationship.
Very good. Very good, very good. And actually today we're going to talk a little bit about that because I think, there's a lot of God's hand in the work that you do, correct?
Amen. God gives you a plan and a purpose, and then you get started. A lot of times people, Tracy, they get started without a purpose and a plan from God who made them. So imagine you're wanting to work, but someone made you and created you to do something for them. You might want to ask him why he made you and why he put you on earth with another 8 billion human animals created in his image, right? So he's got a plan, and it's a perfect plan.
Very good, very good. Well, let's talk about his plan for you because you have been through hair loss twice, right? So today we're going to talk about you as our case study. And you've been through hair loss twice, at least in your life that I know of, correct?
Good thinking, Tracy. You're right. So the hair loss that has happened to me is I've got both types of hair loss, and one started 30 years ago, 20 years ago, the genetic hair loss. And that's the one that we started down the road working on. And then just 3, 4, 5 years ago, with the immune-mediated hair loss attacked my hair. And we've been wrestling with that one for a few years. And now we've got a formulation to treat that one as well.
All right. Well, let's start at the beginning, shall we? What was it that caused you to get into treating hair loss and finding the cure for hair loss in the first place?
All right. Good question, Tracy. So my mother told me age 6, God made you, sent me to you to be a physician and heal these people. That was age 6. So by 9, first Bible, baptized at 12, always knew physician. What kind? No idea. When the medical interviewer said, what kind of doctor? I said, a good one. And that was it. So I knew that hair loss was in my family history. I remember in high school, someone said, your dad lost his hair, your older brother lost his hair, therefore you will lose your hair. And my response was, God tells me everything, and God never told me I would lose my hair. And here I am, age 50, and I still have a head full of hair. So someone tells the truth down here.
But you did for a little bit, right? Like this. How old were you in this picture?
All right. So this type of hair. So when did I first noticing that I had the genetic hair loss and I was starting to respond to that genetic influence, and my hair started looking like my dad's and my older brother's? So that was right after medical school. I could tell my hair was thinning and receding. So in the picture on the left, it had thinned so much that you could see through. Those aren't missing hairs, but the hairs were so thin that when it parted, you would see the scalp. So I knew I had to address that early on. In biochemistry class, I remember one of the research articles dealt with 5-alpha reductase inhibition of the dihydrotestosterone molecule. And I knew that was going to be a problem that we had to deal with. So I found a dual acting regulator of the enzyme, and I think that was 1996. We followed that molecule for quite a while, and that happened to turn into become the dutasteride ingredient that we use in our formula. But I'd like to highlight that although we use the dutasteride molecule, we do not use the Avodart formula. And that's tricky down here because the Avodart formula created 30 years ago was created to tackle the prostate cancer disease. So the formula had, the goal was to decrease all of the androgen hormones, and it does a good job of that. Our formula does not do that. Our formula uses one of the dutasteride ingredient molecules, but not to reduce all hormone molecules, only to reduce the dihydrotestosterone molecule. We then use the first law of thermodynamics, and we take the DHT molecule and we turn it cleverly into the free testosterone molecule, which gives our patients more energy and more focus and better vitality. So that's the key. And you're right, Tracy. So you've got here, the hair was in the front, it was thinning. I'll try to do a little drawing here as well.
Yeah, I'll remove
So
mine
the
and then
front,
you can.
the front was receding backwards, and then the front piece started opening up. And you'll see over here, it stopped opening up, and then the hairline came back down, and even the temple zones 1 and 3 filled in. So it turned out
that's
great.
a big.
This was the genetic hair loss. Yeah.
Yeah, that's a big difference in terms of our area in particular, right?
Yeah. So we treated this using an oral supplement, and we had to then work on a topical. So at this time, this is 20 years ago, the topical we were addressing using injectables. So we were injecting the hairline, and we were trying to decide. The study was, we had head to head, we had injections going next to the topical dropper, and the patients were having to come in once a week, once every 2 weeks, once a month, trying to do the injections. And we were trying to determine which one was going to work the best. And after the couples of years of trials, the dropper ended up being the most convenient for a lot of our patients. You couldn't come in to get injected. Some people thought the pain, it was a little bit painful. So some people didn't want the pain. Some people didn't have the time to come in every week or every 2 or 3 weeks. So we moved to a dropper that they could apply at home themselves, and it worked out great. So we use an oral plus a topical. The oral works inside the body to stop what caused the hair loss, and then the topical will regrow the hair follicle. Now, once the hair regrows enough, we no longer need the topical to regrow. We can have the oral that will maintain it. So the things that we need to do to preserve the hair loss will decrease over time. Now, what happens sometimes, Tracy, we treat the genetic hair loss. So this is the androgen. We went over this last podcast: genetic, androgenetic, androgen, all of those genetic hair loss. So we treated the genetic hair loss. And then 20 years ago, 5 years later, or 5 years ago, 20 years after we treated the genetic hair loss, we ended up with the immune-mediated hair loss. And how did we know the difference, Tracy? Well, if you go back over if we go over our podcast from last week, first it was the symptoms. We started noticing an asymmetrical hair loss pattern. And instead of thinning miniaturization, we ended up with hair fall, missing follicle. So missing follicles in a distinct area is called alopecia, hair loss, areata. Okay. So
there was actually a few areas though, right, that this was happening.
Okay.
Actually, that's not one.
That's it, Tracy. So this immune-mediated hair loss can affect any area of the scalp. We've exposed the 5 predisposed areas of genetic hair loss, but the immune-mediated hair loss can affect any of the zones of the scalp, can also affect the beard, can also affect the forearms and hands, can also affect the legs and the feet. So anywhere you have hair, the immune-mediated hair loss can affect us. So what Tracy has in front of us today, so the first type of immune-mediated hair loss I had all the genetic hair came back, and I have all my hair. And as I'm combing my hair, I noticed some hair falling out over a couple of days that led to about 10 days. And then as I turned to the side, I noticed a spot missing in the back of my head right next to my ear. And the picture over there Tracy has up, this is the first type of hair loss that I noticed, which was this area. And this hair didn't miniaturize over time. This took about 2 weeks and all the hair came out. This is hair fall. And when you look in the microscope, there are no follicles present. Okay, so very obvious for us to diagnose this type of hair loss. Thankfully, God left just a little rim. You see this little rim of hair here, and God left just this little rim of hair. And I've always worn my hair pulled up, and I wore my hair pulled up, and no one could ever see this type of hair loss. So God wanted me personally, privately, to see this type of hair loss so we could treat it. And this type of hair loss was affecting me long before it started affecting any of our patients. So this was the first that I noticed of the immune-mediated hair loss. And if you notice, there's a little bit of blood in this photo because I had injections right at the border. So the theory was that this was an immune-mediated response. So the immune system was attacking the hair follicles within this patch of skin on the scalp. Why this patch of skin on the scalp, no one knows. But how to stop the area from spreading, we put a barrier and we injected an anti-immune, telling the immune system to decrease your immune response at this barrier. And then 90 days later, Tracy has the photo on the website. Do you have that one, Tracy?
Yeah, I have it here.
Okay. And this one, right, 90 days later turned into,
there's the before and
look
after.
at this, right? So does it work? The immune-mediated regulation? Yes. Okay. It turned out great. All right. We thought that was the end of it. And then a few months later, as I'm combing my hair, I noticed more hair falling out. And I said to myself, all right, God, we're going to do this again. All right. But then I started looking around where the areas were. And Tracy has a photo there on the right and the left. And you'll notice as it first started, it was on the top, even in the genetic predisposed zone 5 and zone 4. But look at these distinct areas of hair missing. And over to the left, you'll see there, we counted about 9 distinct areas. And you'll notice some of the pink redness of the skin. So this is acute. When it's acutely happening, you'll have a little erythema to the area, and then it'll heal and crust over. So this was 4, 5, 6 months after the original, Tracy. So this was too many areas to inject, right? No way we couldn't keep up with the injections. That's when we developed a dropper. So same thing that we thought about for the genetic hair loss, we created a dropper formula. So we thought, let's create a dropper. So the original we treated with the injection, then we moved to the dropper, and we treated this one with the dropper. And you might as well just look at me. I've got all my hair back, okay? And Imelda in the office has way more photos than Tracy does. So you guys type in and ask Tracy, go find that good photo of the hair of the doctor in the back, because Imelda in the office has it, okay? All right, great.
In the meantime, let's just put your head down and let's have a look.
So you see all the hairs there. So
Beautiful.
so we treated the genetic hair loss, now the immune-mediated type of hair loss. And a lot of times they call it telogen effluvium, alopecia areata are the other terms, but very difficult to be treated. You have to learn a lot about how the hair loss patterns are showing up in the office. And then you have to look at the blood work to find out what the ratios of the free T, the DHT. So a lot going on, but once we decide which type of hair loss, we can address it, and the results are great.
Perfect. Sounds good. Thank you so much, Doctor. We appreciate it. So everyone, if you want more content, please subscribe, like, follow us, and then send in your questions and send in the topics so that we can ask Dr. Ray for future episodes.